This is CGTN, China Global Television Network.
Hospitals in Tunisia run out of ICU beds as coronavirus cases spike. India's hospitals nearing the breaking point amid low oxygen supplies as COVID-19 spreads. And Indonesia's military says a submarine that disappeared off the coast of Bali has sunk. Hello and welcome to Africa Live. As always, great to have you with us. I'm Richard Nta, live in Nairobi. And for those of you joining us from across the continent and around the globe, we thank you for joining us. Let's take a look at other stories making headlines this hour. A potential new malaria vaccine posts impressive results in trials among babies in Africa. And in sports, African football teams at the Tokyo Olympics face an uphill task after being drawn in tough groups. Once again, welcome to Africa Live. So good to have you with us. I'm Richard Nta. Let's begin in India, where several cities are declaring lockdowns over the weekend as the country battles a second devastating wave of the pandemic. Scenes of deserted roads and markets could be seen across the country on Saturday, but very different scenes are inside the country's battered hospitals. Many are near the breaking point, and oxygen supplies are running low. COVID-19 cases are doubling every 10 days in India, with their total caseloads now at over 16 million. CGTN's Ravinder Bawa has more from Delhi.
With virus raging through the capital, Delhi, patients are being rushed to hospitals. Helpless relatives are struggling to get their loved ones treated as there is a shortage of oxygen, medicines and hospital beds.
My mother needs oxygen. There are no beds available, nor oxygen anywhere in Delhi. I phoned the helpline numbers given by Delhi Chief and Health Minister. They said they don't have any beds.
I have been roaming around for a hospital to get my mother admitted since April the 21st. I have visited all the hospitals in Delhi. They all say the same thing, that beds are not available. Another patient, my son, is at home. I don't even know about my own health. Possibly, I might also be infected being around them. Think of our situation. Please, I pray to you and the government. Please do something. Please do something.
India has seen a rapid rise in cases as new variants are ravaging through the crowds. Experts say it's normal for viruses to mutate and produce different versions of themselves.
What we know broadly, yes, that they have higher infectivity because the S protein that is mutated in 484 position, they bind to the human receptor called ACE receptor 10 times more tightly than the original virus. It simply means that it has more ability to very quickly infect.
More research is being done to establish the link between the discovery of these mutant strains and the new surge in viral infections. But are these mutations making the virus more dangerous?
I think more data will need to come out. If the death rate is similar to death rate before, then you can't say more deadly. Does it infect younger people? Yes, there's a very clear data. The younger people are being infected and falling prey. Deaths are occurring in younger people.
Experts say virus will eventually fade away and become seasonal. How quickly we can get there depends on successfully keeping the transmission rate as low as possible. Ravinder Bawa, CGTN, Delhi.
Tunisian officials say hospitals have run out of ICU beds as coronavirus cases in the country spike. The North African state has recorded around 10,000 deaths since the start of the pandemic. CGTN's Adnan Chouachi reports.
Tunisia's health ministry has been working to provide more ICU beds and reduce the pressure on public hospitals.
The health department is under pressure to provide ICU beds. We've reached the limit in public hospitals. We've used the equipment gradually, but the surge in infection cases is unprecedented. We've requested help from private clinics.
The Prime Minister criticized the lack of support provided by the private sector to the COVID-19 task force. Moreover, the government is considering requisitioning private hospital beds.
ICU beds are not available. We're looking for urgent solutions. The problem of lack of means is critical. The government will not hesitate to take new measures to provide ICU beds.
Health authorities have warned of the spread of the more contagious UK variant in the country.
The UK variant of the coronavirus is deadly in Tunisia. Its spread has caused the sudden need in ICU beds and ventilators. Hospitals are under pressure.
According to the National Observatory of New and Emerging Diseases, 92% of ICU beds and 85% of oxygen-supported beds in the public hospitals are currently occupied by COVID-19 patients.
The Scientific Committee on Coronavirus has warned that the health system in Tunisia is collapsing in the face of an unprecedented surge in the number of infections. The health department will increase to more than 360 the number of ICU beds. Abdel Shawishi, CGTN, Tunis.
African countries have worked hard to boost their cold chain capacity as the continent undertakes the biggest immunization drive in history. Most COVID-19 shots can be kept in minus 25 degrees Celsius freezers, except for Pfizer, which needs to be stored in ultra-cold conditions at minus 70 degrees. In South Africa, for instance, where second phase registrations are open, storage and distribution went smoothly in the initial phase, but now as the country prepares to scale up vaccinations, it requires greater storage capacity. CGTN's Julie Shire reports.
The first phase of South Africa's COVID-19 rollout was relatively small. Almost 300,000 vaccines were transported and delivered to nearly 50 hospitals under strict temperature controls till they reached the arms of healthcare workers.
For the J&J vaccine, it can be kept in the freezer long term. So that's minus 15 to minus 25 degrees. And then it can also be kept in the fridge for 28 days. Once it's delivered, we first check that the temperature has been maintained during transportation. And then we immediately offload the vaccines into our freezers and fridges. All our equipment is backed up on a UPS system and a generator, and we have a continuous monitoring system.
South Africa will soon step up vaccinations in a second phase. Large consignments of both Johnson & Johnson's and Pfizer are expected soon. Pfizer especially needs to be stored at ultra-cold temperatures.
And from the outset, there was already a lot of concern, not just from Africa, but from various countries around the world about the minus 70 degree storage that was in place. It requires special fridges and refrigerators and refrigerated equipment. It's very costly. So you would also then have that issue about where can they be stored reliably.
The Africa Centers for Disease Control is working with countries on the continent to boost cold chain storage capacity. Resurgence, a part Chinese-owned South African company, may also have a solution to moving vaccines at minus 70 degrees.
We ended up inventing this case behind us, and the long and the short of it is that using a specific methodology as to how you deploy the cryogenics, we've managed to achieve a hold time for up to 25 days for vaccines at minus 70. You don't have that many remote locations where you've got access to that kind of cooling power. This is entirely mobile. It's on wheels. You can move it around.
The mobile freezer can store up to 10,000 vials and has been designed specially for areas with limited resources and unstable power supply.
You want to ensure that the product that's in there remains stable and also viable for use, and that's where that's so important. You can transport cold storage at, let's say, minus 20 degrees Celsius with in a deep freeze type truck, so that's quite easy. But anything lower than minus 20, it's almost impossible to be transportable.
South Africa's health and storage facilities and distribution network is better developed than most African countries, but it's going to be a mammoth task to deliver vaccines to all corners of the country as it aims to achieve herd immunity by the end of this year. Julie Shara, CGTN, Cape Town, South Africa.
International medical charity Médecins Sans Frontières, or MSF, says measles is once again on the rise in the Democratic Republic of Congo. Health officials have recorded 13,000 cases and more than 100 deaths in the northwestern part of the country. CGTN's Chris Ochemringa has more from Kinshasa.
Humanitarian agencies have sent medical supplies to 4 provinces in the east and northwest of the DRC to curb the spread of measles. Cases of the disease have been increasing there since the start of the year. A measles vaccination campaign rolled out by the government last year was poorly attended because of the COVID-19 pandemic, and that has resulted in a rise in cases.
MSF est très inquiet de la résurgence des rougeoles.
Médecins Sans Frontières is very worried about the resurgence of measles. Health officials in the country have recorded 13,000 cases and 180 deaths of measles since January this year. 80% of the cases are concentrated in 4 provinces, North and South Ubangi, as well as Myeni and Basuele provinces.
The upsurge in cases comes a year after the DRC government declared the epidemic over. That outbreak was the worst recorded in the country. More than 460,000 children contracted the disease and nearly 8,000 died of it. Measles is a viral disease spread by coughing or sneezing. Children with the disease can get serious complications, which can result in death if left untreated. Chris Ochemringa, CGTN, Kinshasa, Democratic Republic of Congo.
Authorities in Indonesia now believe a missing submarine sunk, ending hopes of a rescue. The country's Navy recovered several pieces of debris from the vessels off the coast of Bali. All 53 people on board are thought to have died. No sign of them have been found, and crews are still searching for the exact location of the submarine. Officials have not yet said what led to its disappearance during a dive on Wednesday. And let's turn our attention to South Africa now, where a youth wing of the governing ANC party staged a protest outside the U.S. Embassy in the capital, Pretoria. The organization is demanding justice for Lindani Myeni, who was killed by Honolulu police in the United States.
According to Lindani Myeni's family, the 29-year-old former rugby player was set to return home in June to introduce his baby daughter. Instead of that joyful reunion, the family is now waiting for Lindani to come home in a coffin. Myeni, who's from KwaZulu-Natal province, was allegedly shot 4 times by U.S. police officers who said they were responding to a burglary in progress at a nearby home. Myeni's wife, Lindsay, took to social media to express her grief and anger. She believes his death was racially motivated. Here in South Africa, Myeni's killing has sparked anger and frustration. It's a story that is making headlines around the country. The ANC Youth League National Task Team staged a picket outside the U.S. Embassy demanding answers.
We want the U.S. Embassy to tell its government that South Africans and young people in South Africa demand the repatriation of Lindani Myeni's remains. We demand a thorough investigation into his life. We demand the release of the footage of his arrest and his killing. We demand the records of the 911 call, unedited, that was made. And we demand the release of his cell phone and all his other personal belongings to his family.
Myeni's killing has once again put the spotlight on the conduct of the police in the United States. Many black men have died at the hands of the police in that country under controversial circumstances.
We are saying that for far too long has the life of a black person been absolutely worthless. And for far too long have black people been killed for absolutely no reason, and that needs to come to an end. It is indeed the worst nightmare of any black person in the United States, where you can literally be killed just for walking in the street.
South Africa's International Relations Department is engaged in talks with the U.S. Consul General to bring Myeni's body back home. In a statement to the media, The U.S. Embassy says they are monitoring the investigation by the Hawaiian authorities. Myeni's family is now preparing to file a wrongful death lawsuit against the city and county of Honolulu. Yuli Sanjamela for CGTN in Johannesburg, South Africa.
3 students who were among those abducted from a university in Nigeria's northwest Kaduna state on Tuesday have been found shot dead. CGTN's Deji Badmus has more on the story.
Nigerian officials are blaming the death of the Greenfield University students on their abductors and investigating the motive for the killings. No arrest has yet been made on the case, and no group has claimed responsibility for the abductions or the killings. And there's no word yet on the remaining missing students. The kidnappers were said to have contacted the parents of the students, demanding $2 million in ransom payment. Negotiation was still going on when the bodies of 3 of the students were found.
The bandits are trying to put pressure on the government, especially the Kaduna state government, and then to make sure that they don't run out of business. You see, the Kaduna state governor had decided that he's no more going to pay ransom. He used to pay them, and now he has decided zero tolerance. And that zero tolerance is why they are running all over the place.
The government has condemned the killing of the students, with President Muhammadu Buhari describing it as a terror attack and vowing to bring the kidnappers and their sponsors to justice. Tertiary institutions in the state are now coming under increasing attacks. Last month, bandits attacked the Federal College of Forestry Mechanization, killing 1 student and taking 39 away. The bandits would later release a video of the students and demanded a hefty ransom from the government to free them. So far, only 10 of the students have been freed, while 29 are still being held. The Kaduna state government has said it will not pay any ransom to the bandits.
We will neither negotiate with criminals of any description, nor support any grant of amnesty to them. Criminal gangs, bandits, insurgents, and ethno-religious militias made a conscious choice and decision to challenge Nigeria's sovereignty and menace our citizens. These criminals must be wiped out immediately and without hesitation.
This year alone, suspected bandits have kidnapped about 700 students.
Now, I think this is a wake-up call for even the schools that have not been touched yet to start wake up and then start doing something about their perimeter security. And besides the perimeter security, they should be working with the security agencies to make sure that there is a rapid response from the police or the army or a combined team to counter when there is problem.
Late last year, the Nigerian government ordered a full-scale military operation against banditry, but bandits still continue to carry out intermittent attacks despite the military operation. Deji Badmus, CGTN, Lagos, Nigeria.
A potential new malaria vaccine has proved to be highly effective in a trial in babies in Africa. As CGTN's Jane Keogh reports, this has raised hope of reducing the massive number of deaths on the continent due to the life-threatening disease.
It's been a long journey of research against the deadly malaria parasite. But now, scientists from Britain's University of Oxford say they have hit the highest mark with its new vaccine candidate.
So one of the exciting things about this result today is that for the first time, a vaccine has reached the efficacy level that WHO have been looking for. They want a malaria vaccine with 75% or more efficacy by 2030. We think we can do that. So 77% is the highest yet, and could really add to the existing tools that we use to control malaria, meaning bed nets, insecticide spraying, and giving children drugs to kill the malaria parasite during the peak of the transmission season.
The year-long vaccine trials were conducted on 450 children in Burkina Faso. The scientists who are also behind the Oxford AstraZeneca COVID-19 vaccine say they now plan to conduct final stage trials.
We're doing that starting in just a few weeks, when we will, at 5 different locations in Africa, in 4 countries, Kenya, Tanzania, Burkina Faso, and Mali, vaccinate young children again, this time 5 to 36 months of age. There'll be almost 5,000 subjects in the trial, and we will follow those for some time, vaccinating them against malaria, or in some cases with a control vaccine, and asking how protective the vaccine is, but very importantly, monitoring those thousands of subjects for safety.
Malaria has been a complex challenge for scientists across the world. The world's first and only licensed malaria vaccine developed by GlaxoSmithKline is only partially effective at around 30%. The malaria parasite is carried in the saliva of Anopheles mosquitoes.
There are multiple stages to the parasite's life cycle, so it's complex. But this is the sporozoite stage. Immediately after the mosquito bites you, it injects sporozoites. And if you can tackle that stage of the life cycle and clear the infection, that will prevent any disease. And that's what we're doing in most of these children when we vaccinate them. The problem, as you say, is you need very high levels of immunity to get a malaria vaccine to work. So we've really optimized the design of a previous vaccine called RTSS. We think we're producing stronger antibodies. They seem to be a bit more durable and certainly a bit more protective. And that's because we have redesigned, if you like, the vaccine itself and added a different adjuvant.
Malaria kills up to 1 million people annually, with children and expectant mothers the most affected. Africa records the highest number of these deaths due to poverty and poor health infrastructure. Jane Keo, CGTN.
African experts have been reacting to speeches made at the climate summit by leaders such as China's President Xi Jinping and Nigeria's Muhammadu Buhari. Nigerian environmental officials say that developing countries need financial and technical support from developed countries to bridge the gap. Meanwhile, Zambian educationalists see a link between technology and conservation.
I see a president that has great compassion for green development and providing solutions to solve problems for the common good of all. He emphasized the need for all to promote green development, which, particularly in developing countries, we have not embraced. And for us to really achieve much, we must embrace that aspect in order to mitigate the issue of climate challenges and also the governance.
When you look at production, economic growth, the fundamental principles for future economic growth lies on these principles of harmonization between human existence and nature. And you already see that it is intertwined with the green development thinking and the innovation, that our technological innovations should not be at variance with these key points of environmental conservation, green development, harmonization. So our investment into technology should facilitate trying to address the environmental negatives so as to assure and secure the current developmental needs and the future for the developmental needs for the generations.
The Chinese Consul General in Cape Town, Lin Jing, has given a lecture to students in the city. The lecture was about the relationship between Africa and China and how it has evolved. Those attending were students from the University of Cape Town, the University of the Western Cape, University of Stellenbosch, and the Cape Institute of Technology. The lecture was themed Solidarity for Future Mutual Development. Students present said they were able to learn about China, its history, and its ties with Africa.
The relationship between South Africa and China is going to assist to speed up the alleviation of poverty within our black communities and bring them up to speed with those who are privileged and those who are haves over the have-nots.
Because I'm a development student and I'm also a leader on my campus. And I've learned a lot today. I've learned about the relations, I've learned about the interests at China. And if we do apply this unique China type of development, it will assist us because China comes from a similar circumstance as our.
Africa Live. Find your voice.